Now we're going to move along to chronic diseases. And the representative person here is Dr. Craig Earle, right behind me. As a senior scientist at ISIS, director of the Health Services Research Program for Cancer Care Ontario and Ontario Institute for Cancer Research. So Craig.
Thank you very much. I'm going to be taking you on a whirlwind tour of the milestones of chronic disease research for the 7 chronic disease programs at ISIS, starting, of course, with 1992. If you think back, you'll remember we were scandalized by the Long Island Lolita, Amy Fisher, shooting the wife of her lover, Joey Buttafuoco. These are names. It was the year of Lorena Bobbitt, slicing off the member of her unfaithful husband and throwing it out the window of a car. And we were scandalized by the inequities in access to cardiac surgery. It turned out that, with groundbreaking research, that if for patients with similar symptoms, the thing that determined how long you waited for these sorts of procedures was where you lived. The median time could range anywhere from 8 days to 48 days, and over a third of patients requiring urgent surgery were waiting longer than the recommended time. 1993, as is noted in the timeline, this is great, I just saw this timeline today, and there's a little bit of overlap, so that's good. 1993 was the last time that the Blue Jays won the World Series. It was the last time we had a female prime minister, but it was just the start of ISIS' push to shine a light on the issues in Ontario with orthopedic surgery. So at that time, doing studies that involved doing pre and post assessments of patients' function and quality of life before surgery and looking at wait times, et cetera, ISIS researchers were able to show that, first of all, over a third of patients were waiting more than a year to have joint replacement surgery. And that if you looked at the degree of symptomatology, it had nothing to do, there was no correlation between the wait time and the burden of symptoms. And that if you could just try to match those a little bit better and prioritize patients based on their symptom burden, that you could relieve a lot of the burden from these diseases. 1994, I see there was a whole film this morning about this. This, of course, was the year that Justin Bieber was born. And Ontario was in an affordability crisis for the healthcare system, a political crisis. But as you heard this morning, there was a real lack of data to allow anyone to do anything about it. And so this is when ISIS published its first Patterns of Healthcare in Ontario Atlas, compiling utilization data, health quality indicators, outcomes, etc. Unfortunately, the post-Bieberrian era started with the first of 3 NHL lockouts. And as a metaphor for the study that was published here, Tanya Harding's husband had just clubbed Nancy Kerrigan's knee. And on the heels of that came research from ISIS showing that women do in fact suffer more lower extremity pain than men. And despite being equally willing to undergo surgery for this, joint replacement surgery, men were 3 times as likely to undergo these procedures than women. 1996, the second atlas came out. This was a time where the population had been growing, several 100,000 patients every year. But this was the first time in our history that healthcare costs had actually stayed flat. So this was a time when people were doing more with less, really. And so the second atlas was able to build on the work of the first atlas, but drill down more, showing that the regional disparities were actually increasing because of some of these effects. And this is when research and reports from ISIS actually led to a call for a restructuring of our healthcare system to be more regionally responsive and accountable, something that was later taken up to at least a certain extent by the Ministry of Health. If you're like me, there are two things that you remember about 1997. I remember exactly where I was when I heard that Princess Diana and Dodi Fayed had been killed in the car crash, and the ISIS first cancer surgical atlas. What this atlas showed was that within our cancer system, at least at that time, there was actually plenty of capacity, but the problem was that it was poorly distributed, such that people living in some parts of the province were getting way too much care and overtreatment, while other parts of the province were not even getting the basics in terms of their treatment. This sort of data-driven approach to looking at the distribution of healthcare services or cancer services was actually embraced by Cancer Care Ontario in that year with its formation on April 29th. And cancer research at ISIS really took off the following year with the addition of the Ontario Cancer Registry to the standing data holdings at ISIS. And so, Monica Lewinsky aside, the big news of that year was the arthritis atlas that came out, which showed that this arthritis and related diseases affect 20% of our population here, and the direct costs to our healthcare system were $1 billion. Now that can sound like a lot, and it was back in 1998 dollars, but as the US Senator Everett Dirksen famously said, $1 billion here, $1 billion there, pretty soon it starts to add up to real money. What this atlas was able to show us was that while those were the direct costs, they actually paled in comparison to the $3.7 billion lost in our society due to productivity losses because of these diseases. Now, it's already been mentioned, I think Jack Williams was mentioning, 1999, I'm sure you're actually trying to forget because it was a year of great anxiety. We were incredibly anxious that planes were going to be falling out of the sky because of the Y2K bug. And so it was only appropriate that the Mental Health and Addictions Program published its first report on health service delivery and services within Ontario, looking mostly at the transition and the effects of the transition from institutional care into community care. There was also a cardiovascular atlas that had some very interesting findings, in particular looking at the socioeconomic status and its effect on these services. So it turned out that if you were a high socioeconomic status Ontarian, you were 23% more likely to undergo cardiovascular revascularization after a myocardial infarction. You waited 45% less, and probably most troubling, that for every $10,000 increase in the median income in your neighborhood, you were 10% more likely to be alive a year later. The new millennium, Jean Chrétien was our prime minister, and in fact we had just handed him an even larger majority. In the United States, George W. Bush had just become president, winning the Electoral College, though losing the popular vote to Al Gore. And as has been mentioned, Andreas Lapakis became the president and CEO of ISIS. And this was a year that the ISIS chronic disease programs took stock of themselves and published several reports looking at the methodological reports, looking at data quality, data accuracy, et cetera, with which they do their work. 2001 is when the Canadian dollar hit rock bottom at 63 cents US, but that was just the start of a climb and better times ahead. And that was the time that CIHR invested in funding for CCORT, the Canadian Cardiovascular Outcomes Research Team, and that the Stroke Registry was launched. In 2002, we were listening to Walk On by U2, which won the Grammy that year, and there is a tie-in, it is appropriate, because the diabetes program was just starting to show a whole series of work about how there were big variations in the incidence of diabetes, that a lot of it had to do with distribution of money, socioeconomic status, et cetera, and as you've heard, that eventually it drills down to one of the major factors being the walkability of your neighborhood. And so they published a series of reports over the next couple of years, eclipsed only, I believe, by the Da Vinci Code. That's actually a fact. I think you can write that down. 2004, and the second NHL lockout. The second Arthritis Atlas also came out, and this is when the lung disease program started describing the burden of asthma and other chronic lung diseases within the province. And this justified the establishment of a surveillance system for these diseases. 2005, Clint Eastwood's $1 Million Baby won the Oscar. This was back in a day when he was known for giving good performances, not speaking to an empty chair. And there is a tie-in here as well. The cardiovascular disease program launched its EFFECT study, which you've already heard about, eventually finding that public reporting did not affect the performance of hospitals and processes of care. But it led to JAK2, ISIS, C-Court, building on the fabulous work that had been done in Ontario to do a pan-Canadian cardiovascular atlas. And with momentum building, the implantable cardioverter defibrillator registry database started. 2008, Dave Erbach leads the publication of the second ISIS Cancer Surgery Atlas. In 2009, the kidney disease program comes on board, starting to publish high impact publications like the other programs. In this particular example, looking at the long-term effects of acute kidney injury. 2010 is when there was for the first time, data liberated from the fortress. So the formation of the CD-Link program that has allowed de-identified linked data to be released from ISIS directly to investigators for research, as well as several other new initiatives in screening, mental health, etc. And then you've already heard that in these last couple of years, one of the major milestones has been bringing in new data sets from places other than the Ministry of Health, which is greatly enriching our ability to understand health and the determinants of health. And so here we are in 2012, building on the initial work started, as you can see, from the cardiovascular program, the arthritis program. There's been an exponential growth in the number of programs, the output, the quality of the output. I fully believe that we're going to survive this third hockey lockout as well, intact. And I also fully believe that the most exciting milestones are those that are still to come and that we'll be able to talk with you about at the 30th anniversary of ISIS. Thank you very much.